Good morning. I'm Troy Thompson. I'm a coding educator. I'm here to talk about ophthalmology and the ICD10 updates that's going to begin on October the 1st, 2016. The Centers for Medicare and Medicaid Services allowed a one-year grace period for unspecified codes during the inaugural year of ICD-10. However, that year is now up, and CMS will now expect physicians to document and code with high levels of specificity for conditions that fall within their specialty. Although still allowed, the use of unspecified codes should be rare, and most unspecified codes should fall outside the physician's area of expertise. For all claims with dates of service on or after October the 1st, 2016, you must use the updated ICD-10 codes. If you do not, CMS will reject all claims using the old codes and your practice will not get paid. For commercial payers, some may take longer to update the codes. This could result in claim denials and payment delays on a month or more. What can you do to help? You can, the provider, document to the highest level of specificity. Please indicate the eyelid, laterality, and location. For instance, upper left, upper right, lower right. These must be documented in your dictated note. If something is still probable or suspect, code as a sign or symptom until a definitive diagnosis is made. Document any cause and effect relationships. We would also like you to keep the problem list and email up to date. Add new code diagnoses when appropriate and remove duplications, conflicting information, and incorrect diagnoses when possible. For ophthalmology, one of the largest changes were bilateral codes. They have been added to include separate codes to specify which eye. Retinal occlusions, macular degeneration, and the codes for primary open-angle glaucoma are now identified by the stage of severity and laterality. Be specific when documenting diabetes mellitus with ophthalmic conditions. That is, diabetes mellitus due to underlying conditions, drug or chemical induced, diabetes type 1, diabetes type 2, and other specified diabetes. These codes now see the addition of laterality when related to diabetes with retinopathies. They also include the stage and with or without macular conditions. This is going to be classified with the 7th digit. We would also like you to add to those diabetic patients the status of their drug use. For instance, they may be on oral hypoglycemic drugs or use oral anti-diabetic drugs, or they may have long-term current use of insulin. There are also further specifications for non-proliferative or proliferative that I've listed below. New codes for vein occlusions. There's a change to the 6th digit, which shows the laterality, and the 7th digit is for the stage with macular edema, retinal neovascularization, or stable. The same is included for central retinal vein occlusion with macular edema, branch retinal vein occlusion with macular edema as well. For glaucoma, unspecified eye codes were eliminated. There are now staging codes, and this is very important. If the code includes an eye indicator, then stage each eye. If no eye indicator, code for the stage of the most severely affected eye. And those 4 stages are listed below. For neuro-ophthalmology, There are no unspecified codes, no bilateral codes. These codes are now single codes. Examples of those are listed below. Oculofacial. Most of the unspecified codes were eliminated. For ectropion and entropion, include lid laterality as the last character. The reason that I'm continuing to identify this is because we've seen from experience on a lot of our notes that the providers are not being specific when it comes to the eyelid, and we really need your help in this area. For retina, most unspecified codes have been eliminated. Some of those are the ones that we've gone through, such as diabetic mellitus type 1 and 2, and the degeneration of macular disease, disorders, and so forth that's listed below. For cornea, we have unspecified codes eliminated. Cornea dystropias, no laterality, only single codes now, as well as corneal transplants, no laterality, only single codes. Foreign body injury and lacerations, no unspecified codes, but there has been a 7th digit added to identify A, initial encounter, B, subsequent encounter, and S, sequela. So that's a really big difference. For herpes zosters and herpes simplex and such, there are no unspecified codes. Those codes have their own specific diagnosis code. For pediatrics strabismus, there are no unspecified codes. I have some of those diseases, pediatrics, listed below that we can follow. There are also new codes added for fractured eye, and I did put the beginning of those codes. The last 2 digits are going to be contingent on where the eye is and what's going on, so you will know by looking at this code. But the beginning of the code is SO2.30. Now for the orbital flora, there's a new twist to this as well. There's laterality, there's encounter, whether or not it's open or closed, and they want you to specify whether it's at the visit routine healing is taking place, or if it's delayed healing, or it's the subsequent visit. Many codes have been deleted or revised. Those codes that's revised are mostly procedure codes. So now the procedure codes have been separated to identify hemorrhage or hematoma. Well, that's it. And you can reach out to me at any point, and I'll be happy to get back with you. We do have a tip sheet that we'll be sending to all the departments at one time, at some time soon in the future. Thank you very much.